So if we're going to shift to our next discussion here, and I have the opportunity we have a special guest before we proceed to the final portion of our agenda. And as they're taking the stage, I want to remind the Roundtable members that at the conclusion of this discussion segment, I'm going to ask each of you to come to the microphone and share with us your thoughts and observations on the day. And then we will, when we're finished with the Roundtable members, I'll ask anyone else who's in the room who wants to do the same. So I will ask you to self-select yourselves to do that. And failing that, I'll select you to do that too. So I'd like each to hear from each of you is what I'm trying to say. So we are quite privileged to have a special guest with us today. And Michael Villaire is going to knows this guest very well and is going to introduce her. So please proceed.
Thank you. I think we're just going to sit here if that's okay with everybody.
That's fine.
Thank you. Appreciate that. Hi, everybody. First of all, I wanted to say thank you so much to Lila Hernandez and Rima Rudd for allowing me the privilege of introducing a very good friend of mine and a mentor who has taught me quite a bit. So when we talk about Cecilia Doak, a lot of the terms that come up are words like pioneer, the godmother of health literacy, her and Len Doak, that they essentially created this field. And she may argue a little bit with you on that, but it's really not very far from the truth. You can see in her biography a lot of the work that she's done, her and Len did for many, many years. A lot of this culminated in the publishing of a book that we always refer to as the Bible of health literacy. It's a book called Teaching Patients with Low Literacy Skills. That was published in 1985 and reprinted in 1996. It's unfortunately no longer in print. However, if you visit Rima's site at Harvard, you can download it for free. We also reprint and as a gracious offering from Cece that we reprint that and hand that out to everybody that attends our conference. So we're continuing to get that book out into the world. When I think of Len and Cece Doak, the phrase that comes to mind is fortuitous pairing. Here are two people who came from very disparate backgrounds, and Cece will share some of the stories there. But what it really was Cece coming from a public health patient education background and Len coming from an adult education literacy tutoring background. And when we think about what could happen when those two people came together, it was actually rather magical. When we think of fortuitous pairings, we think of groups like pairs like Lewis and Clark, George and Gracie, Fred and Ginger, Batman and Robin. But I just try to imagine some of the conversations that went on in that relationship, and they must have just been fascinating. Here are two people who really lived at the intersection of literacy, education, and patient education. There was a spirit of inquiry, I would have to think, that questions came up, and Cece will share one of those stories with you. But one of the great things about Len and Cece was that they showed us really how to do it. And from what I can see, there was really three things that happened. They asked questions. I think any great endeavor really starts with people just asking a lot of questions. Why is this? Observing something and asking why it is. And then there's really just the notion of going out and doing it. Take a look at her bio. You can see they taught over 200 workshops. They evaluated and rewrote over 2,000 pieces of healthcare instruction. And the third thing I think that they really taught us about was to ask the people who received those materials, did it work? Were you able to learn from that? And I know one of the great things that Len was always a champion of was, let's include pictures in that. Pictures, pictures, pictures. And I tell you, that is one of the things that we have taken to heart and that we have really implemented in this field, and has really been a thing that has grown success. I would like everybody to know, if you didn't know already, tomorrow is Cece's 91st birthday, so happy birthday. I would lead you in a chorus of happy birthday, but I hold a tune like a sieve holds water, so I won't torture you with that. But one of the things is, when we think about Len and Cece, we really, it is Len and Cece. And when Len passed away a year ago, July, Cece and I worked together and created the Leonard Doak Memorial Health Literacy Scholarship. And we presented the first scholarship at our conference this year in May. And due to lots of gracious donations from everybody out here, that scholarship's going to continue to provide some training for people who go out and do exactly some of the things that were talked about today in terms of going into areas, underserved areas, and implementing specific programs to help people. And they are very lucky to have Cece as a mentor for those programs. And so without blathering on any longer, I'll turn it over to my friend and my mentor, Cecilia Doak.
Oh, thank you. Thank you, Michael. I'll recap a little of this. You know, our paper, Health Education for Illiterate Adults. Now, do you think today we would ever give a paper called Health Education for Illiterate Adults? You know, where were we coming from? It was the first public health address on the problem in June 1978 at the Western Branch Public Health Association meeting. Now that paper, as well as all of our subsequent work, really started, and keep this in mind as you think about retirement and what you want to do in retirement, started with Len's volunteer work on a one-to-one basis, working as a tutor, teaching adults how to read and write. Let me stop right now. How many of you have tutored an adult to read and write? 1, 2, 3, 4, 5, 6. Good, 6. Oh, good, good. I think it gives you a feel that you get in no other way to really experience what they're going through in their very sincere, committed effort to do what we do just naturally. Len was a highly trained electrical engineer, and I was in charge, way at the other end of the continuum, I was in charge of continuing education for physicians when I retired from the public health service at that time. You know, so I asked Len, I said, you know, what do your students do when they go to the doctor? Oh, he said, Cece, that's easy. They fake it. Because they don't want to be embarrassed. The doctor may not treat them anymore if they have to say, Doc, I haven't understood a word you said. From that point on, we decided to do something about it. So our Norfolk, Virginia Public Health Service hospital study was on patient comprehension assessment. And it was done completed in September 1979. I want to call your attention to the title. The title went way beyond readability, and it dealt directly with the measurement of comprehension and listening skills. It was the research and the practices of the reading community and the studies in adult education that provided us with the knowledge and skills that we needed. For example, we worked with Dr. Tom Stitch, and all of you know Tom. He became so interested in what we were trying to do that one night he came down to our classes where we were tutoring adults how to read and write and observed us. He said, I just want to see what you're doing. Because he said, I've never thought of this in a group situation. Well, the demand for literacy training was so great in Washington, D.C. and the inner city that we had to go into groups. It wasn't because we thought it was the best way to go, but when you have 27 people who want help, why, you change your mind. The National Institutes of Health, Cancer, Diabetes, Heart, Lung, and Blood, Johns Hopkins, many of the public health federal and state agencies, hospitals, clinics, medical centers, wanted training for staffs. We never advertised. It was all word of mouth, and we were usually booked a year in advance. You know the picture today of where health literacy is, and the projects that we got involved in were similar. Projects for HIPAA, projects for the CDC, training of all kinds. I'm not sure when the term health literacy first started, probably in the early 1980s. And where are we now? We have training, we have workshops, we have research, we have the wonderful program that was given today as an example of what is going on. When was the first readability formula published? Probably in 1923, according to Dr. Edward Fry. The partnerships and the collaboration with the adult education community was called for over 10 years ago with the National Action Plan Communicating Health. And of course, the IOM report 1 year later, Health Literacy, a Prescription to End Confusion, underscored the importance of these partnerships. How's the collaboration working out? Well, certainly the Health Literacy Study Circles plan with Dr. Rima Rudd's guidance is an outstanding example of how to design and implement the health literacy components of the tasks that adults are expected to perform. That is one of the most important missing links in a typical patient education program. What in the world are you training for? What is the goal of the literacy demand of the actions that you're asking the patient to undertake? The collaboration in other arenas may also be important. Let's look at pictures. With Dr. Peter Houts, we published a paper showing that research in all 4 areas, attention, comprehension, recall, and adherence, showed that pictures can, in many instances, provide significant benefits. Another arena is technology. There's a paper published this month in Scientific American entitled, "Why the Brain Prefers Paper," which points out that while e-readers and tablets are becoming more popular, reading on paper still has its advantages. So my conclusion about the view ahead, the view is strong, wide, and will always need your thoughtful attention. I'll close with my favorite quotation. It's not what they read, it's what they remember that makes them learn. Thank you, and blessings on you all. Thank you.